say hi. I'm Jennifer. I'm going to be your nurse practitioner student today, and we're going to take a look at your abdomen and your musculoskeletal and neurological systems today. Okay, so I'm going to have you lay flat on the bed so I can take a look at your abdomen, or on the couch, I'm sorry. So just expose your abdomen. Okay, so on inspection, the abdomen is flat in shape. No visible vessels, it's symmetrical, the skin is, there's no scars or nevi or moles or lesions or anything like that. And now I'm just gonna listen to your abdomen in all 4 quadrants. So bowel sounds are normal, active in all 4 quadrants. And in your arteries in your abdomen with the bell and my stethoscope. First, I'm going to listen to the aortic artery and then the renal, iliac, and femoral. So aorta first. Sorry, just femoral. Okay, no bruise heard in the aorta, renal, iliac, and femoral arteries. So I'm just going to percuss your stomach. The general abdomen is resident, and then I'm just going to percuss your liver borders. Okay. It's dull and there's no hepatomegaly noted. And then now the spleen. And it sounds dull as well. And then the bladder. It's dull as well. And I'm just going to lightly palpate in all 4 quadrants to feel for any masses. No masses felt. Now I'm just going to deeply palpate for the liver. Take a deep breath in for me. And liver feels normal. And then the spleen. And then will you sit up for me? I'm just going to palpate your kidneys in the back. Thank you. Any tenderness there? Okay, no flank. And then just go ahead and lay back for me. I'm just gonna check your arteries, your femoral arteries, and your inguinal lymph nodes. Femoral arteries are +2, palpable bilaterally, and inguinal lymph nodes, no swelling. Okay. So now I'm just going to take a look at your legs. There's a couple of scarrings on your left lateral shin towards your knees. Otherwise, there's no other visible scarring. There's no erythema. Skin's appropriate for ethnicity. It's warm, smooth in texture, good skin turgor, and no edema around the ankles or around the knees. So now I'm going to test the range of motion of your legs. So your hips first. I'm going to have you move your left leg away from your body to the side and then back in. and then the right leg to away from your body and back in. So normal abduction and adduction. And now we're going to test the rotation of it. So I'm going to have you turn your left leg, kind of rotate it outward. Okay, and then inward. Good. And then the other side on your right leg, do the same thing. And then the other way. Okay, good. And then now I'm going to have you take your left leg and bend your knee towards yourself. Good. And then now your right leg. Good. So good range of motion of bilateral hips. And now, good. And now this one. Good. Okay. And then I'm going to put my hands on either side of your knees and then just push outwardly. Okay. Good. Good strength +2 on both sides of the knees and the hips. And now I'm going to check the range of motion of your ankles. So first take your left foot and kind of rotate it, and there you go. And then do the other direction. Okay, good. And then for your right foot, and then rotate the other way. Good. So it's good rotation on both ankles. And then so now I'm going to have you point your toes towards your head and point them away. So good range of motion, normal range of motion for bilateral ankles. And now I'm going to have you pull your toes towards yourself. Point your toes, I'm sorry. And then now point them down. Good. Good strength in bilateral ankles as well. And then now your toes, I'm just going to check them, palpate them. There's no nodes or bunions or anything like that noted. And I'm just going to have you kind of point your toes upward against my hands and then down. Okay. So she has good strength and range of motion of bilateral, all 10 toes of bilateral feet. So now I'm just going to examine your shoulders and your upper extremities. The skin on your shoulders and arms look normal, no erythema, a little scratch there. And skin on the bilateral shoulders and arms are normal texture, no scars, or a couple of nevi here and there, no erythema noted. And now I'm just going to palpate your shoulders in the acromyoflavicular joint. So starting out here, I'm just going to palpate. Now on this side. Now when I come on to the back. Sorry. Okay, no obvious deformities noted in the shoulders. And now I'm just going to palpate your arms and elbows. Your lateral epicondyles are felt here in your left elbow and your medial epicondyle here. No obvious deformities noted upon palpation. And on the right arm, it's your lateral epicondyles, your medial epicondyle, and no obvious deformities noted. I'm just going to take a look at your wrists. I'm going to start with the wrist on this side. The joints feel normal, no swelling anywhere in the joints. And then the DIP joints, there's no Hebrideans or Bouchard's nodes noted on palpation on all of the DIP joints on the right hand. And then just checking the MCP and PIP joints on
the left hand and no swelling or obvious deformities noted. There's no Hebrideans or Bouchard's nose noted on any of her joints as well on the left hand. Okay, and let's bring it back down. And then same for your right arm, bring it out and then bring it down. And then take your left arm and straighten it out and rotate it towards like the front of you and then back the other in the opposite direction. Good. Okay, now on the right side, do the same thing. And then the other direction. Okay. So good rotation, abduction and adduction on bilateral shoulders, full range of motion. And then now I'm going to have you bring your arms like to the back of you. Okay, good. And then now bring your arms up above your head like this and then straight down. So, okay. And then now can I have you straighten your arms out for me like this and then bend them at the elbows towards you and then straighten them out. And then put your palms up like this in front of you and then rotate them the other direction. Good. And then straighten your arms out like this and then bring your fingers and point them towards your head and then straighten them out. Good. And then now take your hands and move the left hand in towards the middle of your body, point it in and then back towards the other direction and then do the same thing for the right hand. Good. And then now I'm just going to have you grip my hands real tight. Squeeze as tight as you can. Okay, good grip strength in bilateral hands. And then now I'm just going to have you push your elbows, bend at your elbows and push against my hands inwards. Okay. And then now like kind of bend your elbows this way against my hands. Good. And then push down. Good. Okay. And now I'm going to put my hands on your shoulders. Lift them up for me. Good. Okay. And then for your hands, I just want test your thumb abduction. So what I'm going to have you do is just push your thumb up against my hand, against resistance. Good. And then on this end as well, push up against my hand. Okay, good. So she's got good +2 strength in bilateral shoulders, bilateral arms, and bilateral hands, and good range of motion in bilateral shoulders, elbows, wrists, and hands and thumbs. Bend forward at the hip for me. So the paravertebral muscles are even, so there's no scoliosis. There was no stand up straight for me. There's no lordosis or kyphosis noted on the spine. And now I'm just going to palpate your cervical spine. And then your thoracic spine. And your lumbar spine. So there's no obvious deformities. And the bilateral paravertebral muscles, no obvious deformities and no swelling as well. So now I'm just going to test your range of motion of your spine. So I'm going to have you bend at the hip towards the front, okay? And now stand up straight, and then bend at your hip to the side. So turn, like, bend this way, good, and that way, good. And then now rotate your trunk to the left and then to the right, good. Good range of motion of the spine. So now I'm going to have you face me, face straight this way, and then walk a couple steps forward, normally, okay. Good gait, normal gait, and then have you walk on your toes from this side of the couch to that side. Good. And then now walk on your heels in the opposite direction. Okay. Good. And then now I'm going to have you close your eyes and then put your hips to like flat against your hips and put your feet together and stand up straight and close your eyes. Okay. So the patient has good gait, normal gait on both walking on the heels and the toes, and there's no drift during the Romberg test. Okay. So So I'm just gonna ask you a few questions now. Will you tell me your full name
Sure, Julianne Forrester,
and when's your birthday?
June 19th.
Okay. And what year is it this year?
It's 2015,
Okay. What's today's date?
April 1st.
Okay. And do you know where you are right now?
I'm at home.
Okay. And
I'm in the hospital.
who's the president?
Barack Obama.
Okay. And then I'm just gonna ask you some questions about like your memory. What did you have for dinner last night?
Last night I didn't eat dinner.
What did you have for lunch? Do you
Oh
remember?
yeah, I had kava mezza grill.
Okay. And what did you do for Christmas of last year?
I was working.
You were okay. So recent and remote memory are intact and alert-oriented times 4. Now I'm just gonna. A hand is worth 2 in the bush. What does that mean?
I mean, it's better to have something than to want something else that's more. You should just keep what you have because you never know.
Okay, that's good. So reasoning's intact. And now I want you to count, subtract 7 from 100, going backwards. So take 100 and subtract 7 from it, and then take that number and subtract 7 from it, and keep going until I tell you to stop.
Okay, so 100 minus 7 is 93, 80 then is 86, and then 79, 72, 65, 58, 51.
That's good. Okay, and then cerebration with serial 7 is intact. So now we're just going to test your cranial nerves. I'm going to put my hands on either side of your head, and I'm going to move them forward, and you just tell me when you can see them in your peripheral vision, okay?
Now.
Okay, good. And then I'm going to put my finger in front of your face and move it to test your visual fields. So just follow my finger. When I move it, just follow it with your eyes. Don't move your head. Okay, good. So cranial nerves 2, 3, 4, and 6 are intact. So I'm just going to test your cranial nerves. I'm going to have you close your eyes, and I'm going to touch your face and tell me where you feel my hand, okay?
My forehead. Left cheek. Right cheek.
Okay. Now I'm just going to have you open your mouth for me, your jaw, okay? Now it's closed. Good. And then now I'm going to have you raise your eyebrows. Good. Smile real big for me. Puff up your cheeks. Good. And then now I'm going to test your hearing with my tuning fork. I'm just going to put it on the top of your head and tell me when you stop hearing the noise bilaterally, okay?
Now.
And I'm going to put it in front of your ear. Tell me when you stop hearing the noise.
Now.
And then behind your ear, tell me when you stop hearing the noise.
Now.
I'm going to do the same thing on this side.
Now. Now.
Okay. So I'm going to have you open your mouth, and I'm going to look in there, and you just say ah for me. Okay. And now I'm going to check your shoulders. I'm going to put my hands on your shoulders, shrug up for me. Okay, good. And then turn your head to the right and then to the left. Good. And then stick your tongue out at me, and then to the right and to the left. Good. Cranial nerves 5 through 12 intact. I didn't check the gag reflex, but if I did, I would take a tongue depressor and touch it to the back of her throat, which would make her gag, and that would mean that the cranial nerve number 10 is intact. So now I'm just going to have you do some motions for me to test your cerebellar function. So I want you to take both of your hands and straighten them flat like this, and then flip them front and back over and over again real fast. Good. And then I want you to take the pointer finger of your right hand and then touch your nose with it. Good. And now do it with your left hand. Good. And then now I'm going to have you close your eyes and stay still, sit real still for me. Okay, now put your arms down and just sit real still for me. Okay. So rapid alternating movements were normal. Finger to toe test is normal. No obvious tremors at rest or with intention. And then I'm just gonna have you hold your hands up for me real quick. I'm gonna move your fingers up or down. Just tell me which way they're going, okay?
Up. Down.
Good.
Up. Down.
And proprioception is normal bilaterally. Go ahead and relax your hands for me, and then just keep your eyes closed. I'm gonna put an object into the palm of your right hand, and you just tell me what that object is, okay? So go ahead and clasp your arms around it.
It's a coin.
Good. I'm gonna put something else in your hand, in your left hand. Just tell me what that is.
It's a paper clip.
Okay, good. So stereognosis is intact, and then I'm just gonna have you keep your eyes closed. I'm gonna test your sensation in your arms and your legs. So first I'm gonna show you an example of what sharp feels like. So this is what sharp feels like, okay? And then this is what dull feels like. And this is what soft feels like, okay? So I'm gonna touch you with one of those three objects in your arms and your legs, and you just tell me what you felt, okay? So, what did that feel?
Soft.
Okay.
Dull. Sharp.
Okay.
Sharp. Soft. Dull. Dull. Sharp. Soft. Soft. Sharp. Dull. Sharp. Soft. Dull. Soft. Dull. Sharp. Sharp. Dull. Soft. Sharp. Soft. Dull.
Okay. So pain sense is normal bilateral upper and lower extremities, and correct stereognosis. Okay, so now I'm just gonna have you close your eyes and I'll check your vibration sense. I'm gonna use my tuning fork, and then I'm gonna touch it to your arms or your legs, and you just tell me where you feel it, okay? Do you feel the vibration? Where am I touching it?
Oh, sorry, my right leg.
Okay. And then now?
My left arm, I feel it. My right arm. Yep, in my left leg.
Okay, good. And then now I'm just gonna check your reflexes. First I'm gonna check your biceps reflex. I'm gonna borrow this arm for you. And just straighten your, just bend at the elbow like that, I'm sorry. Okay, now we'll do this arm. Just keep it flexed. Okay, now I'm gonna check your triceps reflex. And then this side with my reflex hammer. So biceps and triceps reflex are +2 normal. And I'm just gonna have you rest your arm on your thigh like that. Just keep it bent. And then I'm gonna hit you right here, okay? And then the same thing on this arm. So brachioradialis reflex is intact. Now I'm gonna, and +2 on bilaterally. So I'm gonna just check your patellar reflex. And then on this, okay? And then I'm gonna check your Achilles reflex. Okay, so patellar and Achilles reflexes are +2 in normal. So can I have you scoot back in the couch so that your legs are kind of dangling? Okay, I'm just gonna touch the bottom of your feet to test for a reflex. And on this foot. Okay, so Babinski reflex is absent bilaterally, which is normal.